Hello, how's it going? I wanted to make a video to document some of the improvement I'm having, but also in this video I'm going to show, I took some video of the exact exercises that I'm doing that have generated this improvement, and also I videoed some of the problems that I'm having. And so I think first I want to just talk about the prehistory of my back pain, which ever since the improvements I've been having with these new exercises has really caused me to revisit this history and its significance. Before I had serious chronic prolonged back pain, I was very active. I ran a lot and I did a lot of push-ups, and probably 3 times a week I would go running at least. And over time, one thing that started happening was that my right knee, the one I'm showing you in this video, in this picture right now, in the very place I'm pointing to, started becoming very painful after certain runs. And it wasn't really predictable why this was happening. I remember one time on a road trip where I was driving like 500 miles and I didn't have cruise control. It got so painful when I was about 2 hours from my destination. This was after driving for about 8 hours. So imagine I'm pressing with my just the tip, and so the only tendon really that's getting flexed is that one that I've been pointing to. It almost like ceased to work. It was so painful, and I remember for days afterwards I could hardly even walk. And this happened a lot after I would run, but never as much as when I would drive for long distances. And I remember even thinking like, wow, I can't even drive long distances anymore. But since I've been doing these new exercises, when I go running, which I have been able to go running a couple times, which is huge improvement, it starts hurting there. And that has been very interesting. It's something that I will revisit with the physical therapist. Now, the physical therapist perspective is, and freak, I didn't get it, but I'll do it right now. Let's see if I can show you this right now. Okay, basically when I went into the physical therapist, he did this thing where he checked to see how much rotation I would get, if how far this would go this way and how far this would go this way, and same with this one. And basically what we've realized is that this one seems to have less flex than this one. This one goes a little further than this one. And so basically he designed this program where I would stretch, I would do this special stretch that would give me more of this kind of flex. So basically what it would do is make my hips more loose. And he also gave me this other stretch which I'll show you, where I'm lying on my back, and his philosophy is that I've lost movement in my upper thoracic spine, like in the midsection, and in my hips, and because I've lost this flexibility, my hips have nowhere to give, and that's why I feel this pain. And I think that's a good addition to what I already have experienced, and what I personally think to be the case. I do think that I reached a point over time where my body just couldn't adjust to the injury, and that's when it became chronic. And so as I've started doing these stretches, the one significant thing that's happened is my knee starts hurting after I run, which I've only ran a couple times because usually running just puts me over the edge. But okay, so here's the first stretch. Here's me lying on my back. I basically put my leg up in this position. I as he says it, I prime the joint by doing this, where I press on the knee, and then after I prime the joint, I pull the leg over, and I pull it towards my body. And basically what I'm trying to do is over time, what happens is it loosens up. And basically what happens is the more I do this, the more it loosens up. And hence I get more flexibility in the joint, and I can, my hips can take the movement instead of the joint, it all being forced on this joint. The second thing I do is I lie on my back, and I do this thing where, and this is a crappy video, but I'm sorry, I didn't want to record it, but I basically lie on this foam thing, and I stretch out the upper thoracic kind of spine area. And he also has me doing some core things, but most people know how to do core things. And maybe I'll make a video eventually of just the core things. So this I've noticed does seem to help. An odd thing is, over the last week that I've been doing this, basically what happened was that this leg, where this is where the pain is, this loosened up really quickly, and then this leg where there's not the pain seemed to, almost for the last week, I've kind of started thinking, well, maybe it's because I've really focused on the right side and stretching that out because it needed to be stretched out more. But as of today, this last week, it was really a week where I allowed myself to lift a little bit more. I allowed myself to go running. I did the stretches every day. And here it is Saturday, and my hip, where I'm pointing at in this video, is starting to hurt. And yesterday and today, after I would basically go metal detecting, so I'm doing a lot of digging and stuff, it kind of flared up. And so now when I do the stretches, it's basically this side stretching feels a lot better than stretching this side. So it's, in other words, it seems that I'm not convinced that this right hip being tight is totally the problem. I think it's odd that after they measured the bones and stuff, they basically came back and said that I don't have a leg length difference when this other doctor said that I did. I think that's odd. And I really just don't think that this is a psychosomatic thing. I just don't. It seems that my chronic pain seems to be so repeatable. And I'm just glad that I have a little bit of improvement. Again, this is where the pain right now, where it hurts on my back after, and where it consistently, when I have issues, it starts off here and then it creeps up into the upper back. And I haven't had it creep up into the upper back in a long time, so that's good. For literally 2 years, it was in the upper section. When it went chronic, it was all up there. And freak, it took me a long time to figure out how to sit up. You see how I'm sitting right here. I'm sitting up straight, and that has done wonders. Just freaking sitting up straight and doing a little bit of stretching has done a lot. It hasn't improved it 100%, but yeah. So what's up with this knee? Maybe I'm improving enough that my knee is allowed to hurt now, and I'm reversing what happened in some way, if that's even possible. I don't know. This is a long video, but I think I got some good footage and some good information. And the best thing I can say to anyone who is having back problems, you got to start becoming your own doctor, and you got to start working with the doctors and studying, because they're not going to have all the answers. Doctors don't have all the answers. I mean, that's something you got to learn. Their knowledge is very traditional, and I think that the SI joint dysfunction, or these problems with the hip, it's kind of like a marginalized place in medicine, doctors really don't have a good language to discern what's going on. Also, the people, it's like, I don't think physical therapists who are good at what they do work very good with the osteopaths and the regular doctors. Everything seems to be kind of at war with each other and what people know, and no one really in the medical field really works with each other. It's the assumption of knowledge is just that of tradition is that realizing that you don't know something is so terribly bad, especially if you're like a person that has a PhD and someone like a doctor. So you got to go into it knowing that doctors don't have all the answers, and therefore any little bit you can study on your own will help. Another thing is you have, like, the idea of diagnosis needs to change. It's not like you're gonna just find one diagnosis. It's like you're gonna find many diagnoses and constantly be ready to learn the limitations of that diagnosis. Think it through, find the contradictions, find where it doesn't work, and create a more unified narrative, and allow yourself to reconstruct your history and what's significant about your history and how that created what's going on now. And that's the best thing that I could say to anyone is there's no one answer. Everyone has different answers. What you'll find is there's not, like, if you search, you might find a different branch of knowledge. You have different doctors you're working with, and everyone kind of what I'm trying to say is your horizon's constantly evolving, changing, and it's infinitely unique. So the best thing you could probably do is allow your knowledge to evolve as quickly and as fast as possible. I mean, and take it in any direction that seems good. Anyways, there's my thoughts, and hopefully I'll be 100% in no time.